Please tell me that I can't, that I won't, that I fail, that I'll never make it out, yeah. Please tell me all the bad, never good, fill my head full of every single doubt, yeah.
Last but not least, training until failure. The strengths and weaknesses of training until failure. So, training until failure means pushing through repetitions until you're absolutely incapable of performing any more repetitions. Like, if I gave you a timer to do as many push-ups as possible, when you get to that point where you legit cannot complete a push-up, that means that is your point of failure. Individuals' pain threshold is a major factor in training until failure. So this makes it more difficult to reach a true point of failure for the individuals that have low pain thresholds. Basically, like when you're feeling the burning sensation when you're doing an exercise, some people just have low pain thresholds and they stop earlier than others, even though they're capable of performing more repetitions. That's just because psychologically, whatever's going on in their bodies, they just want it to end, and you make the pain end by stopping. Training until failure is very popular and very common for people that are training for muscle hypertrophy. Hypertrophy is really just a fancy way to say muscle growth. So bodybuilders, they almost exclusively train for muscle hypertrophy. Research indicates that training with light weight and high repetitions until failure produces similar hypertrophic results compared to heavy weights. So back during the COVID shutdown, when gyms were shut down, and let's say you only had a 50-pound dumbbell and you were doing goblet squats, performing them until absolute failure, you may have theoretically have been able to maintain and even grow muscle mass, again, assuming you did train until failure. So that means that you don't necessarily need a barbell with all these stacks of 45-pound plates on each side to maintain or grow muscle size. You can still perform repetitions until failure regardless of how light the weight is. Assuming you do go to absolute failure, you may maintain or increase the muscle mass by doing that. Again, that's theoretical at this point. I mean, there has been research that has shown that, but again, the only way to really make that happen is if you do train until absolute failure. So you can't stop just because it's burning too much, even though you can still perform more repetitions, or because you got bored. The theory behind training to failure has to do with maximizing the muscle fibers being used. So as low threshold muscle fibers fatigue, high threshold fibers take over until they can no longer produce enough force to complete a repetition. So pretty much what it means is that we have type 1 and type 2 muscle fibers. The type 2 muscle fibers are the more explosive, high power muscle fibers that you see, like NFL running backs are filled with type 2 muscle fibers versus a marathon runner who is predominantly type 1 muscle fiber. They still have, both of those athletes still have type 1 and type 2 muscle fibers. It's just because of their sports, they're more leaning, the NFL running back is more type 2, the marathon runner is more type 1 muscle fiber heavy. And the thing is with type 2 muscle fibers is that they don't have much endurance, but the type 1 muscle fibers do have a lot more endurance, but they cannot produce a whole lot of strength. So when you're going until failure, the first muscles often being used are the type 2 muscle fibers. Once they fatigue, the type 1 muscle fibers take over until they can't produce enough force, and that's where the point of failure is reached. Research has indicated that there are more neuromuscular gains resulting with training until failure, which is great for when creating the mind-muscle connection. So one of the things that I often do with new clients For example, if I'm training to teach them how to do a Romanian deadlift, I always tell them to picture in their head their muscle fibers in their hamstrings stretching out as they descend and contracting as they ascend. So that way they're able to picture how the muscles are working. And there has been research that has shown that that helps a person learn a workout, an exercise a lot faster, and also be able to produce greater force when performing said exercise. So what happens when you compare training to failure versus training to near failure? By near failure, I mean stopping somewhere between 1 to 5 repetitions before the point of failure. So when volumes are equalized, research has shown that there is no significant advantage between training to failure versus training to near failure. A lot of this has to do with the fact that training until failure induces more fatigue. So that means that if you're training to absolute failure, you have to rest a lot longer between sets. The fatigue is a lot greater. There is a greater load decrease happening, so you're not going to be able to do as many repetitions in the following sets, or you might actually have to reduce the amount of weight but in the following sets, so the volume load actually goes down a lot more when training until true failure versus training until near failure. So stopping between 1 to 3 repetitions before your point of failure, you're going to be able to perform more repetitions for the following sets, and you probably won't have to reduce the weight that you're lifting in the following sets because you're not going to be as tired. For example, if on the two, training to failure or training until near failure, say the goal was to do between 8 to 10 repetitions. If you're training to absolute failure, you might be able to hit the 10 repetitions on the first set, but then 8 repetitions on the second set. The third set, you might not even be able to hit those 8 repetitions, so you'll be forced to reduce the amount of weight that you're carrying. Versus the person that's training to near failure, they might be able to keep it within the 8 to 10 repetitions without having to reduce the amount of weight and still be getting the same quality workout as the person that's training until failure. When volume is equalized, training to near failure statistically leads to greater strength increases for lower body muscles. But what's super interesting is that there's really not a whole lot of difference between the muscle gains that happen between the people that train until failure versus training until near failure when they're measuring their upper body muscles. So that's something, both of those, they still need more research to really conclusively determine. But right now the research does indicate that there's actually a better advantage to training to near failure versus training to absolute failure when you're doing lower body lifts. A good thing about training until near failure is that you're going to reduce the amount of fatigue, which often reduces the risk of injury, because when you're getting fatigued, a lot of times technique starts to go by the wayside. When it comes to improvements in power output between failure and non-failure, the amount of power that is produced between the two has been shown to be about the same. There is no advantage or disadvantage between training to failure or training to near failure. So real fast, when I say training to near failure, again, that could be between 1 to 5 repetitions before the point of absolute failure, in which case doing that, you're still going to be able to produce muscle hypertrophy. You'll still be able to grow the muscle mass size. So if I was to say do 1 to 3 repetitions, reps in reserve, or RIR, that basically means that you're stopping before 1 to 3 repetitions before your point of absolute failure. To adequately find how many repetitions in reserve, your RIR, you should be performing if you decide that you want to train to near failure instead of going to absolute failure. You pretty much have to do a workout to absolute failure. That way you'll have a better idea where you actually stand instead of trying to estimate where you stand. Training to failure may not be adequate for individuals with high blood pressure or cardiovascular disease. I will actually expand that to it really depends on what exercise that you're doing as well and the training age of a person. So when I say training age, it doesn't mean how old the person is. It just means how much experience the person has in weight training.